What if your child's school could prevent their first heart attack? We said our kids are to school for math, for science, and grammar. But what if I told you the school could be the first frontline defense against obesity, depression, diabetes, and even the future cancer? Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at how schools can prevent the child uh, health issues and protect them from diseases in the future. And I'll start with my own story. We never know what a habit we can start in children by what we encourage them to do in school. I remember when I was in school, in my primary school, I started doing the long races. And when I went to high school, I continued doing cross country. And even in the university, I was doing cross country. And even up to date, I still keep my morning job because of the skills that I learned during those early years. And this can also happen to you, so that you create an exercise routine because of the encouragement that you get from the school that you are going to. So let's not undermine this. Your school could be where you start building your healthy habits. But if you are not careful, the school could also where your crisis start. So schools sometimes could be the missing link in a child's health. 1 in 3 children are overweight by age 11. So these are age school-going children. 20% of the children suffer from undiagnosed mental health issues, and 80% of lifetime habits are formed before the age of 18. I've told you my story, and you can see that it started a long way up in my schooling. So this is not just a health issue. It is an education, it is an economic undertaking, and it is also a future survival issues. So how can school change lives? From the school to the clinic, there are 5 health superpowers that schools can take charge of. Nutritional programs. Schools have the very high capacity to determine what children feed on. And if they introduce children to whole meals from the daily meals they take at school and from the school gardens, then kids will learn to eat whole meals with the adequate servings of greens. Then physical activity. Many times we take physical activity as a secondary thing, apart from the normal education program. And sometimes you even take the physical education classes for other classes, which is not right. And we should try to actually utilize the physical education classes maximally. Remember that children require more than 150 hours of moderate to extensive exercises on a weekly basis. So let's take the physical education classes, the playtime, and the sports seriously and give them adequate time. Then mental health support. Having trained counselors in school can help children who are going through drug issues, children who are starting habits like drinking or smoking or use of drugs. They can be able to be helped out of this habit before they get completely addicted. Then health education. The school is a good place where kids can learn healthy habits and good habits of protect their health, like hand washing, proper hygiene, things that are helpful in their health. And then parent involvement, like workshop communication platforms. When parents come for school events, this will be a good opportunity to also give them healthy tips to remain healthy. So these are not just luxuries, they are lifelines, and they can help our future society. As I've told you how I started exercising in my early school years, and I still do it because I learned it. Sometimes it's disheartening when parents come to see me. They want their children to be given letters to stop exercising. And I ask myself, what is your intention for your child? Because a child who does not participate in sports, then we are making them have risk of their health, mental and physical. So exercise is very important. In Finland, daily physical activity in school led to a decline in childhood obesity by 12%. This means also that as we talk about physical activities in school, we should also get qualified trainers for the schools, so that you do not get a math teacher and you give him that is the one who is going to do physical education, because his inclination is toward the math. So during the physical education class, he will teach math because if he feels that students need math more than the physical education, and the results of the physical education are not obvious at that time, but you will see them later on when your health is at risk. So remember that physical education is important. And also, let's get the right equipment. You find that schools do not have games equipment. They need balls, they need skipping ropes, and all those things that they need for games. We need to facilitate this. So in Kenya, school-based deworming program also have improved test scores and school attendance, because children do not have the abdominal discomfort associated with worm infestation. In one of my previous videos, I've talked about worm infestation and its complications, and you'll be able to see that and see some of the common worms in children. In the US, schools with mindfulness program saw a 43% drop in behavioral issues. So teaching kids coping mechanisms in schools can help to reduce behavioral problems and mental health issues if we teach our children from an early age. So the evidence is very powerful. So let's take physical education seriously. Let's carry also more research so that we know things that work and try to improve on them. So remember that you are the voice. So what can you do today? Advocate for health education in your local school. uh, Push for healthy school meals, and also mental health days. Join the Parent Teachers Association with a focus on wellness. Sponsor a school garden or a fitness project. Very important that we undertake this. There are various schools that are undertaking sports complexes. So let's support them so that they support the health of our children. And then demand policy changes from schools, boards, and ministries, so that our children get what is right. It is not just uh, the curriculum education that is important. They also need physical education, which is part of their growth. The health of our next generation is being shaped now through their schools. So it is in the playground, it is in the lunch line, and the classroom. Will you be part of this solution? If you like this content, subscribe to the the overall health YouTube channel for more tips on how to make our children live a healthy life. And also leave your comments on what you think we should do better to improve the health of our children. Thank you for watching.